Hi everyone. Thank you for coming today. I am helping out with the program we have today at the Maxwell and Eleanor Bloom Patient and Family Learning Center. I want you to be aware that Mass General will be live streaming and recording this presentation for Mass General social media. Mass General staff are trained in patient safety and privacy. The staff will not interfere with the presentation. If you're not comfortable asking your questions out loud, you're welcome to place your question in the basket, and I would be happy to ask the speaker for you. In recognition of Pain Awareness Month, today we have Dr. Thomas Cheng. He's the Director of Headache and Neuropathic Pain Unit at Mass General. He is here to give a talk on migraine headaches. Please join me to welcome Dr. Cheng. Thank you.
Thank you very much. It's a great pleasure to be here to present this topic. It's a very common topic we tend to talk about, but there's some new development we can share. Might improve your educational basis about this topic. I think it's very useful. Let me introduce myself to you. My name is Thomas Cheng. I'm the Director of the Headache and Neuropathic Pain Unit at Mass General. I'm a specialist in neurology and also pain management. So basically, I treat patients with headache and nerve pain from the head to toe. And our unit have 6 neurologists and a nurse practitioner. So we all help patients with neuropathic pain or headache. We've been having a very productive year so far for having headache. And also we have a patient symposium at the end of this month. If you want to join us, you can let us know. All of you are invited. So I only work for Mass General. I don't have any other financial relationship with other companies. No disclosure. So today we're talking about migraine. Migraine is a very common condition. How many here in the audience have headache? Almost all of you. So headache is the third most prevalent condition, which is almost 50% of population have headache, once or common or continuous headache. How many here with migraines? Okay, so that's about similar to the statistics. About 14 or 15% of the population has in the United States has migraine. Migraine is not the same as other headaches because it's more devastating. So the most common headache actually is tension headache. Tension headache is 1 in the 3 people in the world has tension headache, but migraine is more devastating, which means will disable you. So migraine is list of the 6 highest specific cause of disability. So tension headache usually does not disable you. You can still work, you can still do things you want to do, but migraine, you cannot do anything else. You just need to get out of the work or lie down and hide in the dark because of the headaches, not just a headache. We'll talk more about this. In the US, 14.7% US population have migraines. Female to male ratio is 2 to 2.5 to 1. More women have headache than men, especially Hispanic. Hispanic female is 2.5-fold higher migraine prevalence than Hispanic male. The white male is about 2.1 to 1 to white male. Asian people is 2 to 1. So there's definitely genetic factors controlling the prevalence of the migraine. So the WHO website, this is a migraine prevalence map. As you know, most of the migraine, the color indicating the prevalence of the migraine in different areas. So the white and orange, the red, they are most prevalent area in the whole world. The blue or is less likely to have migraine in that area. So as you can see, most of the migraine headaches located in the European countries or Mediterranean countries. That migraine prevalence is in the Africa, Asia. And the USA is in the middle. So there are so many factors affecting these numbers. I think, of course, there's genetic factors. People in Europe might have a gene that make them more prone to migraine. And those people who have ancestors migrating from Europe in the USA might have higher prevalence of migraine. So genetic factors first priority consider migraine prevalence. And also there's a cultural influence. People who report they have migraines. So as I have Asian background, and in Asia, people don't report to their doctors when they have migraine. So the number will be low. We think that's just life. So we don't pay attention to it. So that's the thing. And also the food in those areas could trigger the migraines. We're going to talk about migraine triggers in the later slides. And also environment, the weather, the local environmental factors, and the influential. So what is migraine? Migraine, by definition, is a primary headache disorder, which means in previously, in a few years back, primary headache disorder means we don't know. Okay, primary means no cause. But now with more advanced research, we know there's a molecular level. So there are certain molecules in our brain causing our migraine. And we identify several factors. So help develop new treatments. And the migraine usually has no structural cause. So should not have a brain tumor cause migraine. Okay, so migraines supposed to have normal MRIs, normal tests. If you have brain tumor or brain vessel aneurysms, those should not be called migraine. That should be called secondary headache from other causes. In addition to the headache, the migraine usually with other symptoms such as nausea, sensitivity to light, sound, smell, motion, and other neurologic deficits. Some people could even have a stroke-type symptoms. Cannot see in one eye or both eyes, cannot move their arm and legs. Those are different variations of migraine disorder, but they are all migraines. And the most important part of migraine treatment is identifying the trigger. Because prevention is better than treatment. It's probably the best treatment for migraine patients. Once the migraine is full blown, it's really hard to control it. We can prevent it. So what happens in the brain when migraine attacks? So the current idea is there's increased trigeminal activity. Trigeminal nerve is the nervous system in our brain that supply our face and also the blood vessels, and sometimes also to the neck tissues. What happens in this migraine activity is we have migraine. There's increased activity of the trigeminal system, firing the meningeal blood vessels. So the blood vessels become smaller and they become bigger. So this change triggers the migraine. In addition, so the sensory input from the face, such as cold, hot, or stimulation from the eye, bright lights, that will trigger the trigeminal activation in this area. This is the ganglion or trigeminal system. And the other direction, in the neck tissue, such as the neck muscles or cervical spine, could also trigger and activate the activation of the trigeminal nucleus in the brainstem and spinal cord. That both activation will trigger the pain perception. So migraine is a combination of different inputs from the face, from the neck, that trigger your migraine. And the timeline of the migraine attack could be could be divided to prodrome phase, aura, headache, and prodrome phase. The prodrome phase, typically a few hours, days before the headache happens. You feel irritabilities, depressed, have increased yawning. Of course, sometimes you need to go to the bathroom very often. Craving certain food. Sensitive to the light or noise. And you cannot concentrate. You feel just fatigue or muscle ache. And then sometimes you have difficulty speaking or reading, and nausea, difficulty sleeping. Those could be a sign of migraines coming up. In that case, you should pay attention to if that sign leads to the headache later. Because if you identify the trigger or prodrome phase of the migraine, it's much easier to treat your migraines because the medication works the best in this phase. So if you take, for example, people take Tylenol, ibuprofen, or triptans for migraine, that's the best time to take it because you will stop the headache before it becomes a headache, And then some patients with migraine have aura. Aura means a transient neurological deficits before the migraine headache start. So people typically have visual disturbance, see zigzag lines, or blurred visions, or sometimes totally black out the visions. That's usually short, lasts for a few minutes. Some people could feel numb and tingling on their face or their arm and legs. That could happen, but also that should be short and reversible. So that's the definition of the aura. If it lasts longer than a few hours, become permanent, that could be a sign of a stroke. That's something we should pay attention to because migraine people has higher risk of getting a stroke. After the aura, not everybody have aura. Probably like 30% of people with migraine have aura. For people who have no aura, they may have just skip the phase, aura phase, directly from prodrome phase to the headache phase. And this time could be various. It could be from a few minutes to a few hours, even days. And the headache starts with throbbing, drilling, eyes peak, so it could be various pattern of headache. But they are all part of migraine. So, but this headache typically associates with nausea, vomiting, giddiness, insomnia, nasal congestions, anxiety, depressed mood, sensitivity to light, smell, and sound, and neck pain. So a lot of time, people say they have sinus headache. They feel pain here. And then they say they have sinus issues. Sometimes they even have congestion in the sinus. Pay attention, this might not be a sinus headache, this could be migraine. Migraine presents a sinus headache, as you might know. So those are things, the treatment is totally different. So if you see a sinus doctor, they told you it's a migraine, don't be surprised. Because people say, I do feel my sinus is full and I have runny nose. Why can you say I have a sinus problem? Migraine can do that. In addition, migraine can cause neck spasms. People might say, I have neck pain and neck issues, I go for a massage. The thing is, the neck pain could be a part of the migraine symptoms. Those something you need to pay attention because treatment is totally different from muscle ache, from the cervical spine disorder to migraine. And those people respond only to migraine medication. So if you go for a massage, take all these anti-inflammatory drugs for neck pain, it's not going to work very well. So it's time to see a neurologist if that happens. So after the headache, our headache typically 4 to 72 hours. And then if you have headache more than 72 hours, it's called status migrainosis. That's the time you should talk to your doctor or go to the emergency room because if you don't stop the migraine then, they increase the risk of getting complications such as a stroke. So we need to pay attention to this. After the headache stops, you could feel inability to concentrate, fatigue, depressed, sometimes even feel euphoric and a lack of comprehension. That could happen for a few days, 1 to 2 days, sometimes even longer. So people, we call this a post-storm phase. That could, just because you have migraine, you could feel lousy after migraine, and that's very common. So why does someone have migraine? So we talk about family histories or genetic factors. That's important. If your parents have migraine, your chance of having migraine is higher than people who have no family history. Hormonal changes is very important, especially we think that's why the female female has more migraine than the male because the fluctuation of estrogen and the progesterone levels during menstrual cycles. That's a common trigger for the migraine, and also stress that affect your hormone could trigger migraine because of the trigger affect the hormone level in your body. Lifestyle choices. People will live in they work in different time shift. Day shift, switch to night shift, and it's day shift. That's typically is a trigger for migraine. So people with migraine, it's really hard to survive in that kind of working environment. Environmental factors, allergies, that could trigger migraine, as well as other environmental factors around you, for example, smell, light, and noise, dust, they even could trigger the migraine. Those are things we should pay attention to, and those are the triggers for our migraine. So we talked about triggers a little bit, but there are a lot of triggers that actually from food. People don't know they have food triggers unless they identify them. Sometimes it's not easy because maybe something you've been eating all your life and you don't know until you actually pay attention to it. So it's very important to keep a diary so you know that's the triggers. So most commonly is chocolate cheese, especially aged cheese, which is an increased level of caramine. That's the factors could affect trigger your migraine. Oh, sorry. Citrus fruit, MSG, sometimes with Chinese food and then migraine after. And alcohol is very common for triggering the migraines, especially red wine and beer. Dehydration is something we don't pay attention to because in a hot day or humid day, if you don't drink enough fluid, that could be the cause of this. And in that case, it's very easy to prevent it. Just drink a lot of fluid and that help. Or before you go out, make sure you have good hydration. Stress, we all have stress, but if you identify increased stress causing migraine, that typically happen in the afternoon, later in the day, where you have work for a few hours, you're tired, or your boss happen to give you a new project, a timeline. That's usually a stressful condition, and most people usually have migraine in the afternoon after they exposed to stress. People with depression and anxiety, it's very common to migraine. It's hard to know which one is chicken, which is egg, because they affect each other. Migraine causes depression, depression causes migraine. The same thing happens to anxiety. So, but you need to treat it. The way we approach is you got to treat both, depression, anxiety, as well as migraine, to get the best result. Sleep deprivation is also very common. People have difficulty sleeping, or people have difficulty sleeping, keep sleeping. Those are important factors for migraine. Shift work, we just talked about. So if you have you have irregular biological clock from your work, that could cause you migraine. Hormonal changes, we talked about this already. Environmental changes, the weather, hot or cold weather, humidity, barometric pressure changes. A lot of my patients told me, I'm just like weather report, I know the storm when it's coming, before it's coming. And I'm actually more accurate than the weather report. So I believe them because weather changes is a very important factor for the migraine. Some people have more migraine high altitude or flying. Take an airplane and then you have more headache. That's typically associated with the barometric or the air pressure changes. Jet lag. That's also go with the sleep deprivation or shift work, the biological clock interruption. Or real red light. That's a common trigger for migraine. And the motion sickness is something we typically don't pay attention to. Migraine as people with migraine, they have higher risk of getting motion sickness. So those are things you can try to help prevent it from happening. Another thing we want to pay attention to is caffeine. Caffeine could be good or bad because a lot of people, as you might experience, you have migraine or headache, you drink a cup of coffee, you feel better. And that's very common. And then here, especially people drink coffee quite often for their headaches. So it might be good for your headache. But it could be bad because we learned that caffeine overuse, such as you drink coffee, maybe 2 or 3 cups a day or even more, and your headache keeps getting worse, and that means caffeine might contribute to your increasing frequency of headache, and that could be paid attention to. And caffeine works with on the adenosine receptor in our brain. What happens is making your blood vessel go smaller, which is actually good for the early phase of migraine. When the blood vessel dilate, you drink coffee, you might be able to prevent it from getting worse. And that's why caffeine works for migraine. But the thing is, if you take coffee for more than 2 days, like a morning cup a day or morning 2 cup a day, you might feel like your headache, you initially feel better, but over time, it got worse. For example, you used to have 1 headache per week, now you have 2 or 3 headaches per week. Sometimes it could even become daily, and then if you keep drinking more coffee for those headaches, we call this caffeine overuse. That's something that we need to do is the treatment is reduce caffeine, and the headache will get better by itself. You don't need any other medication for it. Some people have a headache during the weekend only. They usually have headache during the weekend, but during the week they are okay. So a few of my patients come here and say they have a weekend headache. I say, do you drink coffee in your office when you work? And they usually say yes. Because over the weekend people sleep late, and then they wake up late in the morning. They don't drink their coffee in the morning, and then that's why they have a headache. So that's the most common cause of the weekend headaches, caffeine withdrawal. So not everything has caffeine, but a lot of things you drink might have caffeine. For example, the regular coffee has 95 milligrams caffeine. Yeah, so even cup of hot chocolate has 90 milligrams caffeine. And then even Coke, Diet Coke, 40 milligrams. And then, do you know, anybody know how many milligrams caffeine in Excedrin? Migraine is about 65. So you take 1 pill of Excedrin, it's like drinking a Red Bull. So that's like a caffeine. How much caffeine is in there? Okay, so pay attention to the medication and then the food or drinks you are taking. They all could have caffeine in there, and everything adds up. So if you drink 2 cups of coffee, will be double, and that increases the risk of getting an overuse headache. So what can we do to prevent migraine? So there are a few bad habits we need to avoid when you have migraine. First of all, stress emotional fluctuation. So if you live a very stressful life, and you might need to try to learn a way to reduce the stress. Typically, you could do exercise, or to do meditations, or have a counseling, psychological counseling to help with stress condition, or you can negotiate with a job to get less stressful work. For family members need support, you might need some help. So there are multiple ways to tackle stress. And then emotional fluctuations is typically associated with stress, and then those are easily tackleable if you can have the stress handled. Ignoring your diet, if you know this food causing your headache, for example, chocolate, but you keep taking chocolate, there's nothing we can do. You're gonna have a headache, because you keep getting the triggers. So let's identify the triggers and then change your diet. Modify your diet is very important. Skipping meals, dehydration, we talked about it, and then skipping meals is very important. Hunger trigger migraine. So if you that's a trigger, you should bring some small foods snack with you when you're hungry. Take some snack. That will help prevent a headache from happening. And if you live in an area or work in an area with bright lights, loud noise, and strong scent, those are something that maybe you can improve, or you can get barriers to avoid exposing to those factors. Getting regular sleep If you are migraine patients, you have difficulty controlling your migraines, you might make sure your regular sleep is important to help control your migraine. Tooth grinding or jaw cleansing. Those are important factors because people don't know that's a factor. People might not know even they crunch or they grind their tooth. Usually your dentist will tell you, oh, your tooth is warm from grinding, and that's a sign. And also you can feel your jaw and see if it's tender and tight, and that could be a sign of it. So those are treatable conditions, and that should mention to your doctor if you do that. And overuse caffeine and medications. So we talked about caffeine earlier, but medications is very important. We're going to talk more in the later slides, but there are certain medications you take every day to contribute your headache. Those are something you should pay attention to. And head forward position, posture. We typically work on computer a lot and we do this, right? And then that's we call head forward posture because we try to look at the screen, or we try to focus on the screen better, but that's a bad posture for headache. And a lot of times people have migraine from doing that. So how do you do? You practice headache hygiene. So you can wear sunglasses if you are light sensitivity, or you can wear earplugs or headphones if you are sensitive to loud noise in your work environment. You can wear a mask if there is a sensitive smell, or if people, co-workers wear strong perfumes or deodorant. Now some masks have like a carbon mask can help those smell issues. Wearing a scarf and hat to prevent exposure to the cold weather or wind, that could be the trigger for your migraine. And food selections, caffeine, medication abuse need to be watched. And keep headache diary. So that's important. Most important thing is keep headache diary. What do? Record the frequency, intensity, and triggers, and also medication use. So if you have a headache in the morning, okay, on your diary you say, what did I do last night? And if you remember what you ate, for example, you ate a cheese snack, and then or eat a pizza, and then that could be a trigger. So you write it down. If next time it happens again, well, and tell your doctor, then that could be the trigger for your migraine. What you need to do is just avoid the trigger. That's very easy. Okay, and then and also it's very important for your doctor to know if you can write down if a medication works for you. For example, if you have a headache in the morning, when do you take the medication and how much, and how does it work? For example, if you cut it down, if you take medication that reduces the headache to 50%, that's the valuable information for your doctor to know. Nowadays, there's an online app. I don't know if you guys use it, but you can record everything on your cell phone, which is usually with everybody all the time, right? So you can write down how bad is the pain, how much medication do you use, and how much relief do you get. And then they generate a PDF report for your doctors. You can have a monthly report to your doctors, so your doctor will know how often you have headache, how you respond to medication, and then they will know better how to manage your migraine. So that's an important way to keep a headache diary. And adjust lifestyle habits. Regular exercise, as we know, is important for migraine prevention. Without medication, and avoid regular sleep, meal patterns, and stress management. We talked about this. Physical therapy may be helpful. Okay, for people with head forward posturing, it's really hard to correct on your own because most people don't even know they have this posturing. So therapists will tell you what you need to do to ensure you have good posturing. Lower your shoulder, stretch your neck, and then make sure your neck touches your collar if you wear a shirt, and that means you are in good posture, okay? And then if you cannot do that, then you might need to work on your muscles to adjust your posture. So that would be the therapy to work for. What do you do when migraine attack? So if you are in the middle of a meeting when there's a migraine, or you're in the middle of work when the migraine attack, what should you do? Well, the most important thing is get away from the trigger. So if you know there's the noise in the meeting causing the migraine, then you might need to get out of the meeting. Sometimes it's hard to do that because but there are ways to handle that. And then if you know the loud noise from your neighbor is doing that, you can wear an earplug or something to avoid that. If you don't get away from the triggers, most likely the headache will be getting full blown and make it difficult to control. Also take medication as early as you could in the prodrome phase, so if you feel something is ongoing, you feel like that's definitely the sign for your headache is coming. Then you should take medication right away. So most people take over-the-counter medication, such as we are talking more about these options, but the earlier you take, the better it's going to work. And some people might use prescription drugs to help prevent the full-blown migraine from happening. A lot of people feel better on aspirin than beforehand. So that will help reduce the sensitivity of your nerve. The trigeminal system will try to calm down the trigeminal system from putting the aspirin on your face. Might help. Drink fluid. If dehydration is the factors, the hydration will help reducing or preventing the headache from full blown. And that would be a good strategy to do. And if you could, you can rest in dark and quiet room. So that would be the best option for migraine people. So I told my patients, if you go to the ER for migraine, it's not be a good option because the ER is usually noise and there's a light and there's very stressful conditions for people with migraine to go to the ER. It's much easier if you stay home and call your doctors, talk about the options of treatment. And relaxation techniques. If you know, you can relax with some breathing techniques, regular breathing, deep breathing. Some people even know how to do mindfulness meditation. Those are helpful for reducing the migraine intensity, also help preventing a full-blown migraine. And then acupressure might be helpful. People go for acupressure, that might be helpful. And sometimes you can do it yourself. I'm an acupuncturist too, so I can teach you a few points you can use when you have migraine. There's one on our hands. If you put hands together like this, and put your index finger, cross your hand like this, and then the tip of the index finger is the point. This point is called round 7. Okay, so it's on the top of the bone, and you can feel there's a groove underneath your finger. That's the point. If you massage it, they help avoid migraine. Yeah, and also there's a point on your ear. It's a migraine point. It's an auricular ear acupuncture. So you can just massage. You can use a little lotion to massage your ear a little bit, make it turn red a little bit, and that helps reduce the migraine. A lot of people massage their temporal. This is another point here you can do to help. So those are some kind of self-help skill you can use to help your migraine. Just as I said, if you are having more than 72 hours, you should talk to your doctor about it, okay? If the medication doesn't work, you might need to switch to different medications or try stronger medications, but those usually require prescription. So there are a lot of over-the-counter medication we can use. These medications have clinical trials or studies to show they are actually helpful for people with migraine. As you might all know about this medication, acetaminophen or Tylenol, you need to take up to 1,000 milligrams, which means nowadays it's 325, so maybe like a 3 or 4. That's what they use in the trial. So, but you cannot use more than 4,000 milligrams a day because you have increased risk of liver damage. So that's why you need to watch out. Aspirin is an old drug people use for different purposes, but for migraine you need high dose. And most people cannot tolerate this high dose. So typically each adult aspirin is 325 milligrams. So you need to take up to 2 or 3 tablets to reach this level. So it might not work very well for your migraine if you only take 1 or 2.
Mm-hmm.
And ibuprofen or Motrin, Advil, their dose is 200 to 1,200. They are stronger than these 2 medications, but there's also increased risk of GI bleeding. So you probably, if you don't take it, take with the food, and also try not to take more than the dose they recommended. Naproxen or Aleve, The good thing about naproxen is it lasts longer, so it lasts for 12 hours. So frequently, if you take the other medications, headache will come back. After the medication wear off, naproxen lasts a week. But the thing is, it doesn't work as well as the other drugs, so that's a drawback. There are over-the-counter combination drugs, such as a combination of acetaminophen, aspirin, and caffeine, such as Hsinlin, Migraine. Those work better than over-the-counter medications combined, but there's a higher risk of getting medication overuse because people tend to take that, work very well, but over time, it loses efficacy. It doesn't work that way anymore, and people tend to take more. And as long as they take more, the headache becomes worse. Those are very common cause of daily headache from excessive or caffeine use. Those are something we need to avoid. So you should not use over 2 days a week to avoid overuse headache. If you need it over more than 2 days a week, you need a preventive medication. For the acute migraine rescue medications, this is all prescription drugs. Furosemide is very common prescribed for migraine, which is stronger than the over-the-counter medications. It has the topical, acetaminophen, the caffeine in combination. Now it could be to replace Hsinlin, which is aspirin instead of acetaminophen. These two medications were developed in the 1980s. They were considered as a miracle drug for migraine, but we learned it produced medication overuse headache very commonly. So if you use more than 2 days a week, you are going to have medication overuse headache in the future. That's something you need to be watched out for. Triptans is a newer medication developed over the 1980s and 90s. There are seven of them out there in the market. They have different ways of working, so they are not exactly the same. Some medications have a short-lasting effect, but they're a stronger effect. The other medication is longer-acting regimen, but it doesn't work as fast. It's a short-acting regimen. So you need to talk to your doctor about which regimen is best for you. So how do we define medication overuse headache? If you experience more than 15 days per month for this headache, for at least 3 months, and it developed markedly wasn't during the medication overuse. So if you use these medications 15 days per month, which is probably equal to like 3 days per week or more, and your headache is getting worse, that's the signs of you have the medication over your headache. So it happens when you're taking multiple medications, including over-the-counter medication or prescription medications. But more commonly in narcotic, such as opioid, morphine, Norco, Preventive, such as this medication. The topical containing medications, just like Furosemide or Furinol, those medications have higher potential to cause medication overuse headache. The treatment for this is reduce medication use. That's the only treatment because no other treatment is match bullet for this kind of headache. Even the triptans could cause medication overuse headache. So if you have more than 2 days per week of headache days, you should consider preventive medication. So there are a few preventive medications usually available for migraines. If you have more than 4 migraine days per month, then you should consider taking these medications. There's also supplements for the prevention of headache and over-the-counter medications as well as prescription drugs. So over-the-counter medications, these are supplements. Supplements typically are magnesium oxide, 400 to 500 milligrams a day, riboflavin, vitamin B2, which are very, very effective for migraine prevention. And this herbal regiments for Preventive is over-the-counter. You can get it from a health food store or online, 150 milligrams a day. Might help prevent migraine. CoQ10 is 100 milligrams a day. And the Preventive is another herbal regimen. people have been using Preventive for thousands of years. It's in various cultures such as Chinese medicine, Indian medicine, homeopathic medicine. There is a similar regimen for headache. You need to try 1 milligram a day. These supplements you need to take it every day to work. They all have side effects, but usually it's not as strong as the prescription drugs, but there's still potentials of causing problems. So you should consult your doctors before you take these supplements. So preventive regimens for prescription drugs, there are several classes of medications such as antidepressants, anticonvulsants, beta blockers, calcium channel blockers, and Botox, and CGRP receptor antibodies. So we don't have time to go through every one of them. I think that this is probably a common medications which your doctor might have already told you about. So I'm going to talk about more the new treatments, which might be more helpful to increase your knowledge base. So as we talked about earlier, there's some studies working on the markers for migraine. We identified a new marker called CGRP, which is the full name is calcitonin gene-related peptide. So what happens in CGRP is people have studied demonstrating there's increased CGRP levels for people with migraine. So what happens is if you have increased level of CGRP, there's increased light, smell, sound, and some other sensory sensitivity. So that will trigger pain and all photophobia, which is light sensitivities, noise sensitivities, nausea. So CGRP is considered as an important factor for migraine development. So in 2018, last year, 3 new medicines have been approved by the FDA for treating migraines. So these are good for treat both episodic migraine, which is more than 4 days, migraine days per month, or chronic migraines, which means you have headache more than 15 days per month, with 8 migraine days. So this medication is different from the other medication I usually take for migraine. So, which is an antibody, which means it specifically targets the CGRP in your brain. So there are 4 regimens. 3 of them are available, as approved by the FDA, Amlodipine, and Angiovine, and Galati. They are approved by the FDA, so we are prescribing this medication for patients. It could be used for episodic and chronic migraines, but they are quite expensive. So they are used as the 3rd line or last line of migraine treatment. So typically, you need to try those medications that we typically use for migraine and fail 2 to 3 medications for prevention until your insurance can approve this. So they are injectors. So as you see, Amlodipine comes with an auto-injector, so you can do it yourself. It's just very easy to do. You do it once a month. And there's directions on their website to describe how to do that. Angiovine is a needle injector, so it comes with a needle. So it's not auto-injector, you gotta do it yourself. And also the Galati is also auto-injector. So their efficacy are similar. So no one is better than the other. Typically, they can be used with the other medications, such as the pill you take for migraine prevention. You can add this injection to it, or you can get rid of your pills if the injection works better. Another thing we do in our unit is Botox injections. Botox injections is, as you know, Botox is used for cosmetic reasons, help reduce wrinkles on the face. This therapy is developed by a plastic surgeon in the 1980s. So he started Botox injection for wrinkles, and he discovered some patients told him their migraines have been reduced. That's why it triggered all these studies and trials of Botox for migraine. And now Botox has been approved by the FDA since 2000 for chronic migraine treatment. Chronic migraine means you need to go in there 15-day headache days per month with at least 8 migraine days. And then the good thing about Botox is that each injection lasts for 3 months. And then you need to have multiple injections on your face, temple, and the neck, and shoulder, and those typically prevent a headache for 3 months. So if you have difficulty controlling your headache with medication, then Botox could be an option. But you definitely need to talk to your neurologist about this. Okay, so this is the end of my talk, and if you have any questions, I'm open for any questions. Yes?
Thank you. That's excellent. For supplements, would you recommend, like, I know about magnesium and the B2, but would you recommend, like, another one, or would you recommend all of them if it's once
Actually,
a day, or how would you recommend?
that's a good question. So the response is really very individualized. So you should try to see which will work better for you. But over the counter, there are regiments who have 3 together. If you go online or in the store, there's something called migraine leaf or migraine ease. There are 3 different regimens together in combination, so you don't need to take 3 pills a day. So you can try those too. But whatever works for you is more important. Some people think it's helpful, they worth taking that. I typically will give you like a 2 or 3 months of trial to show the efficacy. If it doesn't help you feel better, then you don't need to continue taking it.
Someone has a question.
Yes.
The older I get, the worse the migraines are. I am in my 50s and they're worse than ever. Why is that?
Okay, so there are several factors for female, right? No, we don't know. Okay, so for female, they are common to have increased migraine in their 50s because they are in the phase of premenopause or menopause. And in that premenopause and menopause, there's a fluctuation of hormones. So one day you could have high hormones, some day you might have enough, and the drop of the estrogen level trigger migraine. And then also people with the 50s, they tend to have more neck issues. As we know, the neck is well off during aging. So if the neck issues could be another factor for people with increasing headache when they reach their 50s. That's a common cause of the headache. Yes.
It's been a very short time, but some of the new treatments, if you have already prescribed them to your patients, do you have any observations of their efficacy outside after the clinical trial? Some of the injections that you showed. What are your impressions of how much they work or don't?
Yes, in our experience, each injection might work or may not work for each patient. There's a good tendency of patient to continue medication if it really help them. So my personal suggestion for the patient is if you feel like you have greater than 50% reduction of your headache, then you should continue. If you don't feel like it's that much helpful, then you should not help it. It's really hard to say how much my patient benefit from the injections. I would say 50-50 at this point. So, but just to say it's a short time, so we don't have the long-term data. On the trial, that shows at least 60% or 70% people respond to the injections. We are a little bit different because we only see a patient with severe migraines. So we don't see the simple migraine, which is our patient typically is more reluctant to therapy. So my experience might not be fair for the trial.
We do have a question here. Have you seen any study that show acupuncture as an effective solution to migraine?
Yes, there are several studies show acupuncture for migraines. They are not huge studies. They are probably smaller studies, but they do show benefit of acupuncture. A lot of studies, if you show, they typically do it for 6 to 8 weeks, so for migraine treatment. So acupuncture is not just one-time treatment for patients with migraine. You need to have continuous, long-term, just like preventive drug. You need to do it all the time to show benefit. It might not work if you do it once in a while. So that's something you should pay attention to. And also, acupuncture has finance concern because usually self-pay. So over time, could cause a financial burden for the patients. So that's another consideration. Yes.
I heard chronic consumption of acetaminophen may induce another type of headache. Is it true? And is it safe to eat acetaminophen when I have migraine?
Acetaminophen, if you take 1,000 milligram for each migraine, is usually okay, but not for people with liver issues. Or people take other medication could affect the liver. So, you might need to talk to your doctors to talk about if acetaminophen is a good right medication for you. But in terms of efficacy, it might work as good as migraine medication if you take it at the right time.
Someone wants to know why migraine sufferers have a high risk of stroke. Why is that?
Yes, that's a very good question. So as we talked about migraine, what causes migraine and what's in your brain when this happens, in the migraine, early phase of migraine, there's a phase of vasoconstriction, which means the blood vessel getting spasms, getting smaller. That could affect the blood flow to your brain. So that's the risk for getting the stroke, because if that's bad enough, your brain may not get enough blood during that period of time, and that could cause damage. So luckily, the oral phase, that's usually this happens, is short, and typically your brain can recover from it. So you might not have a stroke, but when we scan your brain, you might see spots of white spots. Those are not damage, those are we call the tissue with more fluid, which means this happens when a patient with a migraine, their brain tissue could get a little bit more fluid around their area. So that's we call it migraine headache, migraine lesions. Not typical stroke because they are reversible. So over time, this white spot will go away, but that's not really a stroke. A stroke typically provides more stronger headache and also long-lasting neurological deficits. So weakness, numbness over time, never recover or recover for after a few days later. Those are typical migraine. That could be a risk of stroke.
I do have a question. The supplements you recommended, the magnesium, CoQ10, is this something that you should be taking every day or
Yes.
when around the time you get migraine?
Yeah, we recommend you take it every day because that's all the preventive regimens, including over-the-counter supplements or medications, you need to take it every day for it to work. Because those things doesn't happen you need to take it every day for your body to create a level that will suppress the headache. So if you take it every day, the peaks, small peaks, is not going to help.
And do you have a diet for people who suffer from? Is there a special diet for people?
There is no special diet, but the thing is, if you identify the diet factors trigger your migraine, then you should avoid those the food in your diet. Yes.
I have one last question. This is for my father. So he kind of like wants to delay taking his Imatrix because of, like you said, the medication overuse. So, but it turns out he still ends up taking it. So I'm wondering, should he just take it as the first sign of having the migraine start, or delaying taking it might actually make things worse?
Yes. Does Imatrix work for him, or it doesn't work anymore?
Sometimes he has to take a second one.
Oh, I see. So there are a few solutions for this kind of problem. Imatrix pill take about 30 minutes to get in your system. There's also Imatrix sumatriptan nasal spray. Take about 30 minutes, 10 minutes to get in your system. And there's also Imatrix sumatriptan injections. I take about 1 minute or 2 to get in your system. So the regimens you use for the same drug might work differently if you use different regimens. So if you use an injection, typically work better than taking the pill because you need to go through your stomach, absorption, and also get in the bloodstream. But injection directly go to your system, work faster, and also dose is stronger. So that could be the first my first recommendation would be change your regimen first.
So I'm thinking about the diagnosis. So is it just based on the symptoms, what you mentioned, or how is one diagnosed?
Yes, typically the diagnosis for migraine is based on symptoms. So you need to fit the criteria for migraine diagnosis with all this throbbing pain, nausea, vomiting, light and noise sensitivities, and also if you have family histories. Typically, and also you need to have a normal exam. So the exam should be normal. If you have something wrong on your body which you can find, that's probably not typical migraine. So those might need a brain scan. So see your doctor for that. But you only have a migraine once in a while, you have family histories, you are the right age, then probably just migraine, and just do the whatever I just said, and use your help. Yes.
You talked about tooth gritting and jaw clenching. How to get rid of that?
There are a few treatments for that. First of all, there is a bite guard you can get from your doctors. Typically, it's a barrier between your teeth, so you won't grind your teeth so much. That typically will help. Also, there's a physical therapy. You can work on the jaw exercise for the muscles to reduce the grinding. And then, if this from stress, stress management is important. And also, if you have TMJ issues, then you might need to see a doctor for treating the TMJ, the joint issues. So you should probably see a doctor. So we have a clinical trial for people with migraine. So it's try to identify a new market. So if you have migraine, you're interested in getting involved in the trial, she's sitting in the audience, she could provide information. That typically we scan your brain before and after stress management. So that will be measuring your functional MRI studies and PET scan to identify your activity in your brain and also information. So this is different, very different from regular MRI. Regular MRI only shows structure, but now we show functional. So see where your brain is activated, and also where the information is. So that could be very helpful for us to develop new treatment for migraine. So if you are interested in the trial, we can provide the flyers and information after the talk, all right?
Thank you so much.
Okay, you're welcome.
Thank you.